It is now my pleasure to invite Murray Glendining, LHSC's President and Chief Executive Officer, to deliver his remarks.
Thank you, Ruth Ann. Good afternoon, everyone, and thank you for joining us here today. I'd like to start by thanking Ruth Ann and our Board of Directors for their commitment, expertise, and guidance. I would also like to thank Dr. Mark McLeod, whose leadership of the Medical Advisory Committee has been exemplary. Mark has been instrumental in helping to lead our budget consultation process, and through his efforts, our levels of physician engagement continue to increase. I also want to thank all of our partners who have delivered updates today. Tracy, Jim, David, through your leadership of the Children's Health Foundation, London Health Sciences Foundation, and Lawson Health Research Institute, you are helping us improve the quality of care we provide to our patients. Lastly, I would like to thank the people of London Health Sciences Centre. It's my privilege to work alongside some of the most dedicated and innovative people I've encountered in my career. Thank you for the support you have shown and for all that you do. When I came to London Health Sciences Centre, I was drawn by the potential that LHSC had to lead the sweeping transformation of our healthcare system that is now well underway in Ontario. As a highly innovative academic health sciences centre, LHSC provides acute care services across the spectrum of care to a region that is uniquely self-contained. As a result, LHSC and indeed all service providers in this region are well positioned to help define, test, and implement new approaches to the delivery of care. Together, we are working to reimagine our healthcare system so that we can ultimately make care more seamless for patients, both those in hospitals and those within our community. In the package you received is an advanced copy of the latest edition of Inside, which will be distributed across the region on Saturday. I am proud to say this publication is now on its 7th issue, and it recently won a National Healthcare Communications Award. Inside continues to share some of our amazing patient care stories, and in this latest issue we highlight how the research conducted through Lawson has a direct and often immediate benefit for our patients. Wrapped around that publication is a condensed version of our new online annual report, which you can go to learn more about our strategic priorities, how our partners contribute to the patient care we provide, and our audited financial statements. From those figures, you will see that LHSC continues to maintain a positive financial position, finishing the 2012-13 fiscal year with a positive margin on our more than $1 billion budget. We will invest our year-end one-time savings in initiatives that are critical to our strategic priorities and for our sustainable future. Those strategic priorities are what will guide us in all of our work in the midst of the transformation underway in our healthcare sector. The term transformation has been used a lot today. It is not inappropriate given our current circumstances. With the result of the recent election, we expect the direction of the government to remain unchanged. We look forward to working with the new Minister of Health and Long-Term Care, Dr. Eric Hoskins. Ontario is facing financial challenges and an aging population, and we cannot continue along the way we have, as previous speakers have indicated. We have to change the way we think about healthcare and change how we deliver services. We cannot expect annual 6 to 8% funding increases as we have in the past. We've talked about the future of healthcare, but in truth, the future is now. I've seen more change in the healthcare system over the past 2 years than I saw in the last decade. LHSC has long supported the need for health system transformation. It is the only way to build a sustainable system for the future. It will require us to look at how we deliver services, how we interact with our community and regional partners, and to streamline and simplify the patient's journey through the system. This will be accomplished in part through our strategic priorities, which over the past year have focused on our cultural transformation, the implementation of HUGO, and our clinical services renewal, which I will touch upon in a moment. Through our cultural transformation, LHSC has embarked on a multi-year journey to achieve a culture of engagement, empowerment, and accountability that complements and helps achieve our objectives of clinical and service excellence and patient and family-centered care. By building on positive cultures, patients will have a better experience, employees and physicians will enjoy a better work environment, and LHSC will be a higher performing organization. Many of you have heard or read about or experienced the recent implementation of HUGO at LHSC. Just a couple of months ago, HUGO, or Healthcare Undergoing Optimization, is part of LHSC's transformative work to create a fully electronic health record. As part of this recent implementation, all medication orders and medication histories are now submitted electronically, and barcoding technology on patient wristbands matched with barcodes on medication is used to decrease medical errors. When HUGO was implemented, it was anticipated it would take 6 to 9 months to work through the issues and challenges associated with the new way of doing things. We are in the middle of that process now. Going forward, HUGO will be part of our enabling technology plan, which in 2015 will include further optimization of the HUGO project and planning for continued advancement towards a fully electronic patient record. In addition to the implementation of HUGO, LHSC was pleased to recently host the launch of the eHealth Connecting Southwest Ontario, also known as CSWO, initiative. This initiative we are working on with the Ministry of Health and eHealth Ontario. From family physicians to hospital specialists and community health providers, this massive undertaking will enable all healthcare providers, not just hospitals, to securely and in real time access electronic health record data for patients at any point in their care. It's not going to be too long before you as an individual will be able to access your own patient record if you have access to the internet when you're vacationing down in Florida. One of the first initiatives being rolled out with CSWO is the Clinical Connect system, a secure online web portal that provides physicians with real-time access to their patients' electronic medical information from hospitals, community care access centers, and community health centers. Rather than me try to explain its benefits, I'm pleased to show you a video that does it much more succinctly than I can.
Clinical Connect is a secure web portal that allows authorized healthcare professionals to view comprehensive patient information in real time and securely. Medical information like hospital reports, lab results, past lab tests, medications, radiology images, pathology reports, and microbiology results are now at your fingertips. Clinical Connect makes quicker diagnosis, treatment, and improved patient care and safety possible. Now, you can save time for what really matters, caring for your patients. Clinical Connect can be accessed from anywhere, quickly and securely, using a computer, tablet, or smartphone. Connect to your patients with Clinical Connect.
You're laughing. This is real. I mean, Cerner is hooked up, Sarnia is up, Huron-Perth's up, all of the Waterloo, Wellington, Lynn is up, and all of the Hamilton, Haldeman, Niagara, Lynn is up for all hospitals, all CCACs, all community health centers. So we're just waiting to turn it on here, and I think that's just waiting to digest HUGO, get over HUGO, and then CCAC, who are our agency to actually implement this, will be going to our community physicians to sign them up and give them access to this. But it also affects us inside the hospital, because when a patient arrives and emerges from Sarnia, you will have his or her full record available online in real time. Examples such as Clinical Connect demonstrate that the electronic health world is here, and its implementation, along with initiatives such as Hugo at LHSC, show a very tangible change in our ability to provide safe, effective, and high-quality care. This ability has been strengthened through our final strategic priority. LHSC is in the middle of completing our services renewal plan, which is focused on 3 areas: clinical strategy, internal improvements, and partnering in transformation. The purpose of the clinical strategy stream is to define the strategic direction and priorities of the clinical services we provide at LHSC for the next 5 years. It will increase the productivity and cost effectiveness of those services and better inform our resource allocation and investment decisions. It will also identify future population health needs that we will need to serve, as well as targeted areas of medical leadership at LHSC that we want to continue building upon as leading academic health sciences center. Delivering clinical services excellence through patient and family-centered care forms the foundation of our clinical strategy work. The internal improvement work stream will review key processes within the hospital and implement improvement opportunities across the 5 dimensions of quality: integrated, safe, timely, effective, and patient and family-centered care. Ultimately, the purpose of this work is to help LHSC find new and innovative ways to improve both the patient experience and the quality of care we provide. It will also create efficiencies that will decrease our overall costs so that we can invest in our clinical strategy priorities. Lastly, the partnering in transformation work stream represents the collaborative work we are undertaking with community and regional healthcare providers and support services. Together, we will focus on the high users of our health system. These patients represent 5% of our population, but they account for almost 68% of total hospital and home care costs. Through this work stream, we are developing improvement strategies and patient and family-focused initiatives to improve their care. Partnering in transformation will also assess what are known as quality-based procedures, an integral part of the Ontario health system funding reform. The goal of QBPs is to standardize care, improve quality, and increase the integration of services across our healthcare system. We want patients to receive the best care managed in the most appropriate location with the right level of support. This work will require greater focus on working with community partners, addressing patient needs from a systems perspective, and managing care needs across the continuum, from primary care to acute, community, and self-care. One of the most recent examples of this partnering in transformation work is LHSC's purchase of the former Bethesda Center, which will allow us to extend our care into the community for programs whose patients would be better served outside of a hospital setting. This center will become home of our adult eating disorders service, a community-based program provided through a strong partnership between LHSC and the Canadian Mental Health Association, Middlesex. Both the outpatient clinic and the residential treatment component of the program, which are currently located in separate lease spaces in the community, will be co-located in the new center. In addition, our prevention and early intervention in psychosis, or PEP program, will be moving from Victoria Hospital into this new community-based setting. For both of these programs, LHSC will be better able to serve the needs of patients and can do so without increasing costs to the hospital. Last week, we met with members of the River Forks community, where this facility is located, to address their questions and present our plans for the property. They truly are a special community, and they welcomed us with open arms, and it was a pleasant night to be there. There was positive feedback and strong support from residents who also identified issues around traffic flow, safety, parking, and general property aesthetics. And we will work through those issues as we prepare to move into the facility. LHSC appreciates the warm welcome received and is excited by the mutual desire for an open and collaborative relationship going forward. While we have a lot planned for the year ahead, I would be remiss if I did not take a moment to recognize the outstanding achievements and accomplishments of our staff and physicians over the past year. We celebrated an incredible 5 medical firsts this year, including a new world first in the treatment of localized prostate cancer. With so many other amazing things happening at LHSC, we have prepared this short presentation to share some of the highlights of the year. Many of the successes we have enjoyed over the past several years, including those you've just seen, have necessitated a focus on ensuring we can sustain them. Moving forward, an additional strategic priority for LHSC will be on financial and resource sustainability to ensure we are able to sustain our human capital, our facilities, and our ability to provide care in this era of fiscal uncertainty. As you may now have surmised from today's comments, and even the year in review video, working with our community and system partners is a strong focus for us at LHSC. We are increasingly looking for patient and family input, and in addition to our Community Advisory Council, LHSC currently has 3 patient and family advisory councils at the program and departmental level. It is our goal to have more patient advisors involved in all of our decision making, because patients who are at the center of everything that we do. We also continue to strengthen our partnerships with community-based providers, including Middlesex London Health Unit and our Southwest Community Care Access Centre. Representatives with us today, including Donna Ladesseur, Senior Director, Client Services from the Southwest CCAC, and Dr. Chris Mackey, the CEO of the Health Unit. I would like to take a moment to recognize these people and their organizations for their commitment to working together to create a truly comprehensive and seamless healthcare system for our patients. Chris Donner and members of the Advisory Council, could I please ask you to stand? In this time of sweeping transformation and change, it is also a time for stepping up to the plate and rethinking how we do what we do. We have very real and significant challenges at our hospital, especially when it comes to patient access and flow. I believe that all of us at LHSC have a desire to improve and change. None of us are satisfied with the status quo. One example of this can be seen in our emergency departments, whose staff have created an emergency department transformation project with the ultimate goal of making patient care easier, faster, and better. This grassroots initiative highlights the importance of working together, starting small and thinking big. With early successes already being realized, our mental health services team are now beginning to implement the Toyota Production System methodology that Emerge has been following. Eventually, for our healthcare system, thinking big must include the larger picture of health prevention and working with partners in every walk of life to more broadly understand the social determinants of health. In 2010, the Hamilton Spectator released an investigative report that looked at the disparity in health and life expectancy of two groups of people in neighborhoods just 5 kilometers apart. This 3-year health mapping exercise highlighted how the wealth or lack thereof of these two populations seemed to have a direct correlation to their health and health outcomes. The study begged the question, what does equal access to healthcare mean? And what barriers do people face within our system, and how do we remove them? Answers to these questions will require tremendous collaboration from a number of sectors. In London, we are beginning to collect the data that will allow us to better isolate pockets in our city that need more focus and efforts to remove barriers to healthcare and to a healthier life. And I am confident that our early and ongoing collaborative efforts with community and healthcare partners will position us to help address these challenges. Without a doubt, the greatest strength of our organization is its people, and as I conclude my remarks, I would like to take a moment to recognize and thank them. Our staff, physicians, students, scientists, volunteers, and our patients and families, together with a strong leadership team and a committed board, are making a difference every day. I'm excited about the changes ahead, and I am energized and inspired by the people we are working with to make them happen. The future of healthcare is now, and it's only just beginning. Thank you.